Prostate cancer is a serious health concern for men. Radical prostatectomy is a common treatment for this type of cancer. This surgery involves removing the entire prostate gland. While often successful, this procedure can lead to side effects. One significant side effect is erectile dysfunction, or ED. Many men experience difficulty achieving or maintaining an erection after surgery. This is because the nerves responsible for erections are located very close to the prostate gland. These nerves can be affected during surgery. This can lead to temporary or even long-term ED. It's important for men to know that they are not alone in this. It's crucial to understand that ED after prostatectomy is treatable. Early intervention and proactive measures can significantly improve men's outcomes. Erectile function recovery is a slow process that can take up to 2 years post-surgery. Still, we always try to get functional erections as soon as possible after surgery to minimize erectile tissue atrophy and fibrosis and maximize erectile function recovery after surgery. Penile rehabilitation is crucial after radical prostatectomy. Think of it like physical therapy for your penis. Its goal is to restore erectile function and improve sexual health, maximizing the preservation of all components of the local erectile mechanism and optimizing recovery of erectile function. This process helps to improve blood flow to the penis. It also helps the penis to remember how to have an erection. Early intervention is key. The early institution of erectogenic therapy permits the early resumption of sexual intercourse with an increase in confidence. A decrease in confidence is frequently seen in patients who have delayed recovery of erectile function after radical prostatectomy. Starting rehabilitation soon after surgery offers the best chance of regaining erectile function. Men who begin early intervention improve the outcomes. For erections, the patients opting for rehabilitation had significant improvement in natural erection response as well as PDE5 inhibitors and intracavernosal injection erection response after surgery, compared to men who did not start penile rehabilitation, or this was too late after surgery. Delaying penile rehabilitation leads to lower chances of erectile function recovery after surgery. Also remember, open communication with your partner is vital. It strengthens your relationship and helps you both cope with the challenges together. You will have a lot of frustration and difficulties at the beginning, but being constant and perseverant will maximize your chances of erectile function recovery after surgery. Two effective strategies are available for penile rehabilitation. Number 1. PDE5 inhibitors like Viagra, Cialis, and Levitra can help achieve and maintain erections. PDE5 inhibitors preserve the erectile tissue of the penis. It has an excellent safety profile and is convenient for patients. And number 2, medications injected directly into the penis can help achieve an erection. Injection therapy is used for PDE5 inhibitors non-responders. Injection therapy is a very well-known and effective erectogenic treatment. Regarding penile pumps or vacuum erectile devices, these devices use suction to draw blood into the penis, creating an erection. It is easy to use and non-invasive. These are not considered part of penile rehabilitation because of blood that is sucked into the penis. 50% is coming from the arterial side, and 50% from the venous side, with lower oxygen levels to preserve the erectile tissue of the penis, compared to PDE5 inhibitors or injection therapy, which achieve 100% of the blood coming from the arterial side, with high oxygen level that is adequate to preserve the penile erectile tissue. However, these are a good option for preserving penile length after surgery. Your doctor will recommend the most appropriate strategy based on your individual needs. It's important to follow their guidance closely for optimal results. We recommend taking a low dose of PDE5 inhibitors, sildenafil or Viagra, 20 mg, or tadalafil or Cialis 5 mg, 1 tablet every night, for 2 weeks before surgery. After surgery, in the first 2 weeks, the patient will continue with a low dose of PDE5 inhibitors, 1 tablet every night. You will start the challenge or full doses during the 3rd week after surgery. This means that 6 times a week, continue taking a low dose of PDE5 inhibitors, 1 tablet every night, and once a week, you will take a full dose of sildenafil, 100 mg, or tadalafil, 20 mg. You will have sexual activity, and you will test the quality of erection that you can achieve. Please remember, with sildenafil, you need to take it on an empty stomach, with no food or alcohol for at least 2 hours, and then have a sexual activity 1 hour after taking it. For tadalafil, this does not have food interaction, but the absorption is slow and it needs to be taken 2 hours or more before sexual activity. The patient is evaluated 6 or 8 weeks after surgery. If he has erections that are at least good enough for penetration, he will continue with PDE5 inhibitors. We recommend increasing the challenge doses up to 3 times per week. The patient will be followed every 3 months during the first year post-surgery, every 6 months during the second year, and then annually. If the patient does not achieve functional erections during the first 3 months after surgery, or earlier if the patient did not have nerve-sparing surgery, we consider the patient to be a PDE5 inhibitor non-responder, and intracavernosal injection is recommended. The patients usually continue with daily low doses of PDE5 inhibitors, and we replace the challenge dose with 1 injection. The patient will receive the adequate training to start the injection therapy at home. We recommend up to 3 injections per week. The patient is followed every 3 months during the first year, every 6 months during the second year, and then annually after surgery. 1 year post-surgery nerve recovery starts happening, and there is a possibility to respond to PDE5 inhibitors. In our practice, 1 year post-surgery, patients who are doing intracavernosal injections will start doing challenge doses with PDE5 inhibitors monthly during the second year post-surgery. If the patient can achieve functional erections with PDE5 inhibitors, the patients can stop the injection therapy and get back to PDE5 inhibitors. Penile rehabilitation can be challenging, both physically and emotionally. Some men experience frustration, anxiety, or a sense of inadequacy. Remember that these feelings are normal. Don't hesitate to seek support from your healthcare provider, therapist, or support groups. The benefits of penile rehabilitation extend beyond just sexual function. It can significantly improve your self-esteem, relationships, and overall quality of life. Remember, you're not alone, and effective solutions are available to help you regain control of your sexual health and well-being.